Uh, I am here to present a case that we have done recently. So this is a case about 28-year-old female who is a resident of Ahmedabad, came to her OPD with main complaint of pain in the left hip joint since 1 year, and her main complaint was she had her pain all through her activities, that which gets aggravated with standing and movements and occasionally relieved with rest and medication, but most of the time she had the pain, and there was no history of any trauma, fever or loss of appetite and any other joint pains. So on clinical examination, the main findings were she had anterior hip joint tenderness, and there is no local rise of temperature, and terminal range of movements of hips were painful. So we got a CT scan done, and a CT showed a lytic lesion in the superior part of the anterior column of the acetabulum, which is measuring up almost 1.2 centimeters, that is 11 into 14 into 10 mm, which was suggestive of ganglionic cyst. Then we further went with an MRI. Here you can see a small lytic lesions in the MRI also. So they were confirmative of the ganglionic cyst. So the diagnosis were intraosseous ganglionic cyst of anterior column of acetabulum of left hip joint. So how do you want to proceed? Any ideas? We went with arthroscopic debridement and microfracture of hip joint. Initially we did diagnostic hip arthroscopy. With the help of CIAM we placed our portals. We have used lateral portal and anterolateral portal of hip joint. And then diagnostic arthroscopy, we found a lytic lesion at the superior dome of acetabulum. Actually there was a cartilage breach, and this is an intra-op diagnostic picture. You can see a ganglion fluid collected over there, that is a ganglion cyst, and this was the lesion. And then the trocars were introduced.
The above part you see is the labrum, and then this is the acetabular cartilage. Acetabular cartilage of hip is very particular because it is a weight-bearing cartilage. So there was a lesion there on the top, and we have to do a little bit of capsulotomy to go in. And once you go in, there is special lesion. So this is the area where the lesion was there. Okay, and this is the area in which there is a chondral lesion or a chondral defect, which is leading to a ganglion formation, basically.
This portal is from.
So this is an anterior portal, and weaving portal is an anterior lateral portal. So this is the CIAM picture, and we use a curved shaver blade here to reach up to that lesion, because this is a lesion which is in very odd position. So अभी आपने देखा हमने एक half pipe insert किया, and with that half pipe we come with a shaver, and then we start clearing that area. So when you clear that area, you will see that this is actually a very loose cartilage. Everything is very flimsy and loose in that particular region. So when you use the cartilage, you can see that it is very, very flimsy. And as soon as you use that cartilage, you will use that shaver now. If you use the shaver on an intact cartilage, the cartilage will not be trimmed. But if you use it in this kind of a scenario, it will be trimmed out. And then this lesion you make small holes with the microfracture. So that way you puncture that cyst, puncture the ganglion cyst, and अब आप इधर जाओगे you will see that the chondral damage is still. You can just remove it. You can see that fluid coming out from there. So it's a very so it's all the cartilage is all very loose, and we'll keep removing it with the, and you can see that this fluid is coming out. You keep removing the cartilage. Okay. So these are all the cartilage, and then again you do small micropuncture. So basically it happened is this is a chondral defect which has led to fluid seeping in and leading to a ganglion cyst formation. This is how we address it.
Post-op the patient was non-weight bearing.
Post-op you keep the patient non-weight bearing for a month. For 1 month you need to keep it non-weight bearing, and all these small loose cartilage debris you need to clean. And this is a special shaver blade. You need to use a shaver blade which is angled for a best approach. Okay. Fine. Next slide. Okay, this is the final picture.
This is the
This is
final
the final
picture
picture.
showing microfracture and adequate debridement
Debridement of the lesions.
lesion. So this was done in order to enhance the formation of fibrocartilage. And there is a few articles, very few literature available for this intraosseous ganglion cyst. This is an article published in Journal of Orthopedic Case Reports. They have done arthroscopic debridement of ganglion cyst that has originated from transverse acetabular ligament at the tal. This is the preoperative image, and this is the ganglion cyst at the tal. And this is an intraop image showing the cystic mass, and they have shaved and did adequate debridement. This is the post-op after 6 years, where it had shown no recurrence, and the adequate arthroscopic debridement gave good results for this. And this is another article showing the use of